about the Indigenous experience with the COVID vaccine and our COVID health experiences. I'm just going to give a very quick, brief introduction of myself, and then I will hand things over to our guests, and we have a short video to play, and then we'll get going. So I think we've got just about everybody in now. My name is Carrie Schreier. I'm an Extension educator housed in Livingston County in Southeast Michigan. I've been with Extension now, let's see, about 18 years, and I work primarily in the space of child and family development. So talking with children, families, and parents about their experiences and helping to provide support when and where we can. And today we are so excited to welcome two guests from the Saginaw Chippewa Indian Tribe to join us to talk more about the Indigenous experiences with COVID. And so I will hand the floor over to both of you to go ahead and introduce yourselves, and then we have a short video to share.
Hi, I'm Susan Sowmick. I've been an RN since 1984. I work for the Saginaw Chippewa Indian Tribe in public health, and I've been here for 28 years. And I work primarily with elders, and I also do flu clinics. And with COVID, I sort of fell into the role of doing the COVID vaccines. So that's how we ended up here today. And we have
Bonjour, Chimikanik, Nijinikas, Amicdorum, Saginaw Chippewa Dochaba, Nishnabe, and Dao. My spirit name is Big Turtle. I'm from the Beaver Clan. Joseph Sowmick, Saginaw Chippewa Tribal Elder, Public Relations Manager for the tribe, but here to share some Indigenous experiences and teaching. And I just wanted to mention for those folks listening out there in cyberspace that Susan and I have been married for 37 years, and we met right there at Michigan State University. I was a sophomore. She was a freshman. She needed a place to park her car. I haven't got it out of the garage since.
That's wonderful. Oh, what a lovely story. I also met my husband at Michigan State University. So special place in my heart for us MSU couples. Well, thank you so much for joining us today, Joseph and Susan. I'm really excited for this conversation. We will share a link in the chat. We appreciate people taking the time to complete that. That does have our demographic information. But in the meantime, I'm going to go ahead and hand the floor over to our support in the background, who has a short video to tee up our conversation today.
Well, this month is Native American Heritage Month. Michigan has 12 federally recognized Indian tribes, which includes the Saginaw Chippewa Indian Tribe in Mount Pleasant. I had a chance to go to their reservation for a look at their culture and why the passing of traditions is so important.
But when we have our feast or when we have...
The Saginaw Chippewa Indian Tribe working together for their future.
So this here is our greenhouse.
Tanya Antoine and her work at the 7th generation Elijah Elk Culture Center best describes that.
Being able to use our traditional medicines, learning the language that I know.
And when you say medicine, what are the medicines and how do they help?
Okay, so we have 4 sacred medicines. We have cedar, which is like a cleansing thing. We have sage. We have our traditional tobacco that we utilize almost on a daily basis that we offer to the Creator to say thank you. And then we have sweetgrass that is also a traditional medicine. It's a sovereign thing, being able to pass that down.
Say a quick prayer, you know, it's Buju mi jakodne disnakas.
For Eric Sowmick, or Clear Sky, his spirit name, traditions came from his father.
You know, and to have these ceremonies and to have a place to come and get knowledge, you know, that has been passed down. Like these items here that we make, you know, this tobacco pouch, you know, we sew these up and put our tobacco in there, but it's more than just tobacco.
You made this.
Yep. The same could be said for Daniel Jackson, who was drawn into the tribal game of lacrosse.
And I was like, well, what do I want the kids to learn? And this was one of the things that I had to learn. You know, I made our own equipment and, you know, creation story and actually playing and, you know, doing it.
And the story behind it.
It's a healing game. You know, when our elders would watch us play and see one of us get hurt, they'd kind of forget about the pain going on in their bodies.
These traditions don't touch the surface. There are other cultural mainstays of the tribe, like the annual powwow.
There's always a story behind everything that we do. There's always been a history behind it. We do it because that's how we live. That's our Bamadzawin. That's our good life.
But there's a difficulty in keeping parts of the heritage alive.
It's been a challenge since the time I was small.
Like speaking the native Ojibwe language.
How many fluent speakers are here?
That are original tribal members, less than 5.
But there's hope for the tribe's longevity. One of Tanya's sons wants to be a keeper of the culture.
It's important to him as a young man to continue to carry on our cultural knowledge.
And the strong spiritual connection has kept them grounded, even during the loss of 16 family members to COVID-19.
We have a protocol that we follow when we lose our people. So having our culture has really, really helped mentally.
It's saved my life.
Keeping the culture alive is vital because it was taken once before, and the Saginaw Chippewa tribe is sure to not let it happen again.
I know it was taken away and I want it back.
We don't waste anything. The Creator put stuff here for a reason, but don't take advantage of it because you can lose it.
Reporting at Saginaw Ojibwe Ishkanganing Donjaba, Blake Keller, WNEM TV5.
What a lovely kind of very small sneak peek into the culture, the tremendous culture that you have there. Could you talk, is there anything you'd like to share a little bit more about that video before we move into talking more about the COVID specific questions?
Well, I would say, my friend Blake, when we came up with that idea back in 1993, working together for our future, that future wasn't just the Saginaw Chippewa Indian Tribe. That was Central Michigan University. That was the city of Mount Pleasant. That was Isabella County. That was the state of Michigan. And when it comes down to it, we're all part of the circle. My friends from 7th generation and my younger brother, Eric, who was featured in the video, we go ahead and we honor the wisdom of our ancestors. And I'm glad that he mentioned my father. He was a former chief of the tribe. And to go ahead and to talk about the medicines, our way of life, I think that's important. But the healing also comes from the Western medicine and some of the work that Susan has been able to do with COVID-19 and the vaccinations, like the clinic she's doing today, has certainly helped with that, Carrie.
It's fabulous. Yeah, that was such a lovely connection. So our first question here, and before I get going with questions, I do want to remind our participants they're welcome to add questions into the chat if they have questions. The first question that we had submitted, though, was if you could just provide us a brief summary about the historical perspective of the Indigenous experience with vaccine preventable diseases and immunizations.
Well, there's quite a history. I mean, I was doing some research and it goes back to 1520. The indigenous populations in the Americas were naive to communicable diseases like smallpox and tuberculosis and other things that we have vaccines for today. The first case of smallpox was thought to have been brought into the Mexico, what is now Mexico, in 1520. And because the population had no exposure and antibodies to that, it spread across the Americas and was killed millions of people. And so it was thought to have killed up to 95% of the population of the Americas back then. And so it's a horrible history. Now, for the United States, the first Native American involvement with immunizations was 1832. They passed what they called the Native or Indian Vaccination Act, and they actually started bringing what was the current vaccination for smallpox to Native American tribes. Now, even then, there was a lot of political issues with it and a lot of other things that were going on, but it did help save a lot of lives. Back then, as natives were moved away from their traditional lands and onto reservations, and a lot of times west, out away from civilization, They did provide some vaccinations to tribes that cooperated with the federal government. So there's a lot of history there. As part of those promises with moving people, they promised to help with healthcare with the Native Americans, and that was part of it, was the Vaccination Act. So because a lot of the history brings us up to current days, where we have the Indian Health Service, which helps with Native health. A lot of tribes have their own clinics, and that's where I work, as NIMKI Clinic, which is dedicated to the health of Native Americans in central Michigan and tribal members across the country. Because of some of the history with the government, I mean, there's a lot of distrust with state, federal, even local health departments. So having the local clinic for the tribe, it helps bring a level of trust. And we have partnerships with our local health department, the state, and the national IHS, which is Indian Health Service, and the CDC. So because we have our own clinic here as part of the tribe, it helps build trust with the tribal members and tribal community in this area. So while we have partnered with our local community foundations and health departments, we have found that having the local clinic and relationships with community members helps with the COVID, when there was an outbreak and when we're doing immunizations.
Certainly, yeah, it makes sense. There is that long, terrible history of the damage, and you think about smallpox in particular, was so devastating, I know, to the Indigenous communities. You can certainly understand why there's such a high level of distrust with that mainstream medical system. Speaking specifically about COVID-19, can you talk a little bit about how COVID-19 affected Native American people in general, and then specifically there at the Saginaw Chippewa Indian Tribe?
Yes, of course. Why don't you talk about what the tribal council did when COVID hit a little bit?
Well, I think with the tribal government, we knew there was going to be a challenge with it. Indian Health Service got together with the CDC, and the cooperation between the state government and the tribal governments made all the difference in the world, especially for Michigan. Our biggest challenge with the 12 federally recognized tribes in Michigan is, what about the other 84,000 Native Americans that live in Michigan that aren't connected to tribes, that live in urban areas or rural areas? And we needed the tribal folks to step up to the plate from all of these different clinics that we have in the state, and they were able to go ahead and to help with that. But through it all, the tribal council was able to support the clinics and the vaccine programs. And I think some of our dashboards that we shared with MSU Extension kind of speaks towards what we've been doing on immunization.
I wanted to say specifically is how it affects Native Americans. In 2020, there was a study done with Native American mortality. It is actually 2.8 times that of non-Latino Caucasians. So they've had a higher prevalence of not only catching COVID, but passing away from it. Some of the things that affect that and some of the reasons for it is, over the centuries, Native Americans have experienced greater incidence of poverty, food insecurity, access to quality health care, and poor housing. They tend to live in multi-general housing. So you have, grandparents that live with mom and dad who may be working, may or may not, and kids, of course, that go to school. And we all know when school starts, flu and other diseases spread. And then we have proven, there's many studies that show that grandparents, our elders, that live in a household with kids in it tend to have a higher incidence of COVID and flu and strep throat and various other diseases also, because the kids like to spread them around. That's normal.
It makes sense, but yeah, you don't always stop to think about that increased risk factor.
Yeah, so that is quite a risk factor. They also have decreased access to transportation, which feeds into the access to healthcare, especially in the larger reservations where they may be miles. I mean, a couple hours from the local health center. They also tend to have more chronic diseases like diabetes, heart health, obesity than other races at a younger age. There's the percentage of diabetes among Native Americans. There's a history there also, but it's much greater than the general population.
Which, as we know, is another increased risk factor for severity with COVID when we have those extenuating health, those more complicated health conditions, of course.
Yes, absolutely. And I wanted to mention one story about an elder. My primary position has been taking care of elders, and I had one elder that she is multi-generational. I mean, the grandkids lived close and they were over pretty much every day. Her family had some doubts about the vaccine, so she didn't get the vaccine right away. And she said, I don't go anywhere. I don't go anywhere. I don't need the vaccine. And this is one of my ladies. And and her daughter was against the vaccine, but I went to visit her on a Tuesday to drop off some medication and stuff. And she was still adamant she didn't want it. She was starting to cough a little bit. And so I said, you really need to get tested. And she says, well, I don't have transportation today. And I said, soon as you can get one of the grandkids or your daughter to take you, you need to go get tested. 2 days later, she went in the hospital, and 2 days after that, she passed away. And so the stories, and I've gotten so many stories like that it got very personal, very quick. And so one of our, that led into encouraging everybody to get the shot, not to care for themselves. These kids and adults need to get vaccines to take care of their elders who are more susceptible to the disease.
Such a heartbreaking story. There's too many stories like that. I have heard over the years that we've been working on this project, just to highlight. I think oftentimes at this point we kind of forget looking back, or it's easy to forget looking back at how rapidly those things were happening and what a collective trauma it's been, particularly on communities such as yours, where it's that collective loss that people were experiencing in that moment. That's so challenging.
Well, even to put an Indigenous lens on that, if you take a smallpox vaccine, if you look at the traditional history of how Native extermination happened, a lot of times it happened with a gift of warmth. You would think getting a blanket, would be a blessing. And a lot of times our tribe has given ceremonial blankets as a way of honoring people. But a lot of times, back in the American history, those were the blankets that were infected with diseases, and those were spread into Native populations. So naturally, there's that distrust of something coming from the government. And that's why this government-to-government cooperation is so important, from the federal, state, local, and tribal level, all working towards a common goal of public health initiatives.
Absolutely. That's such a lovely summary about the importance of having everybody working together and being able to be those trusted messengers in your community. That leads very nicely into our next question. And you're already beginning to answer it as we're having this conversation. But our next question is about why it was so important to have the COVID vaccine and other vaccines available through the tribal clinic instead of partnering with your local health department there in Mount Pleasant. And I think you certainly have already begun to touch on why that is so important, right? You have that increased level of trust. with your community, but then also transportation and other issues. Can you talk a little bit more about that importance there?
Well, many of our clients at NIMKI Clinic have gone there since they were babies. I mean, as newborns. And I mean, I'm getting up to my third generation now that I'm helping to take care of. And plus, I'm not a tribal member, but I'm married to one. And around here, it's all relative. I mean,
it is all relative.
It is literally all relative.
Yes. And so a lot of I mean, when I started out, even today, I mean, I say, oh, I'm Joe's wife. Oh, I know Joe. I grew up with him. We went to elementary school together. And so it really helps. Even if I have somebody new coming into the clinic, starting out, I encourage them to go to local activities, go to a teaching with Joe, go to seventh generation, go to the senior center, and we'll do a little mini health fair to introduce people. And they make friends, and that gives them the introduction and builds trust. And that trust, I can't tell you how many times when we were doing the clinics and we have a challenge because we have a smaller staff, of course, in the health department. That's why we've partnered to do a lot of clinics. But I don't know how many times I heard that, I don't know them. I want to come see you. You give me all my shots. And so that's right from the beginning, we were begging for vaccine, and doing what we needed to do to get it. And starting with our eldest, clients, and some of them were not local. Some of them had to drive from Detroit. That's the other thing I wanted to mention. When we started doing our clinics, we started from the eldest. I think we had a couple 90-year-olds come in, and some of them drove from Grand Rapids and Detroit to come get that shot. And we were so careful with them. Some of them were so happy to see us. They hadn't been out of the house in a year because they were afraid to go anywhere. And so they would get in here, and we were get them registered, get them in to get their shot. And then in the waiting area, they'd have to wait for 15 to 30 minutes. They didn't want to leave. They would sit there and chat with other people there from their 6 feet away, and they would literally not want to leave. And so it was, along with the sad history, doing it right at the clinic, we had a lot of happy things too.
So the clinics that you were able to offer there were open then to all Indigenous community members in the state of Michigan? Is that when you had people coming in? Is that what you're saying?
Our service area for the clinic is 6 counties. So any Native Americans that are registered for the tribe in the 6 counties, plus tribal members that live anywhere.
Okay.
So my daughter is Minnesota, and she came back and got one of her shots on her trip home.
Okay. Yeah, that's that. And I'm sorry, I should have probably asked that question sooner when you were talking a little bit about the setup of your clinics and who was attending. But it must have been very nice for people to have that connection, to be able to come together finally after being apart for so long, know that they're getting to be a little bit more safe to be out in the world, but being able to see and connect with people again after such a distance of such a time of being alone. That's so challenging.
Look at that as a piece of history also, because when our reservation was formed in 1937, it was basically moving us off from our hunting and fishing and timber lands, our trapping lands, and then a belief that, we're going to move you in the center of the state. We're going to take care of your healthcare needs. We're going to take care of your education needs, and we're going to teach you how to become farmers. And when it comes down to it, when you had that kind of intergenerational trauma where, you were basically an outdoor society, a nomadic society, and now, you're being fed USDA flour, lard, incidences of diabetes, hypertension, and now what we find, fast forward to today, we find Native Americans wanting to move to tribal centers that are closer to the healthcare just to go ahead and to be a part of a reservation now because of vaccine clinics and immunization clinics.
Because of access to healthcare. Yeah. Wow, that's such a valid and interesting point. So our next question here is about if you could speak a little bit to how the Saginaw Chippewa Tribe community as a whole responded to the COVID-19 pandemic, thinking back there to 2020 as things were rolling out across the country, and we were all trying to grapple with what comes next and how we handle this. Can you talk a little bit about how that experience with the pandemic went on and the reservation? And with
something that Sue mentioned, it was the tribal elders leading the way, and think of it more of a social marketing effort. It wasn't until we had tribal chief Tim Davis go into the clinic, and basically it was Sue that gave him the vaccine shot, and then people started looking if our own tribal leadership will go ahead and to do this, and if our tribal elders will do this, well, maybe it's not necessarily a bad thing. But when you come into Nimke Clinic, you also have that traditional medicine too. You have the smudge ceremonies, you have the tobacco, you have the belief in the eagle feather, the drum, the shaker. You're bringing in the indigenous medicine like aromatherapy, music therapy, along with the Western medicine. And for the patients, you get better outcomes when you're embracing both of that. For lack of a better term, cultural health literacy.
That's a lovely phrase that I didn't know, and I'm so appreciative to have heard that. It's so it makes so much sense, but yes, to see all those pieces braid together effectively so that you're able to best treat your community for the best possible outcome in a terrible situation. Obviously, but it's great that those you have that system in place for things to come together. Is there anything else about the pandemic and how kind of just the experience of going through the pandemic, aside from the vaccine, maybe that comes to mind that you'd like to share before we move into our next question?
Well, when we were first starting the clinics, it was so much confusion. I mean, everybody was scared and concerned and confused because of different messages from different people. So we tried to stay consistent and like I said, we partnered with the CDC and health department. And so we tried to spread similar messages, maybe with a traditional factors, brought in, but taking care of families, taking care of others, protecting your elders, and how to do it. And we pretty much followed with precautions. We followed what the health department was doing it, but we would convert it into our own flyers and articles and information using Native Americans to do PSAs and articles and ads, so it was more personalized for the tribe and for Native Americans.
And that representation is so important in this context, to be able to be authentically representing the community that you're serving and making sure that message comes across in the way that you are hoping it is, that it's delivered. Great. Well, our next question is about, sorry, I lost my spot on my list of questions here. Our next question is about whether or not there were programs or incentives that were put in place to encourage vaccination as the vaccines were rolling out.
Well, when we do our vaccination clinics, I do the influenza clinics every year. And so we do them a little bit different. When you're doing tribal events, it's pretty much assumed you have food and that it's a part of a community gathering. And so when we do the clinics, we have snacks and we have drinks and we have Halloween candy because it's usually around Halloween, and they come to expect that. So if I don't bring goodies, then I hear about it. But people look for it's part of being part of the community.
Yeah.
I mean, all of our other events, we have we serve some kind of food also, even if it's just snacks. And it's part of making it a little bit fun to come get vaccines, and a
Yeah.
little bit like the elders sitting around and talking and they didn't want to leave. So we do that normally with the influenza clinics, and we expanded it, and we would have toys for kids that came in. Nothing fancy, nothing expensive. And so you're saying, oh, you get your shot, but here you get a stuffed animal. So it helps a little bit. I mean, kids are always a little hesitant. They know they're getting a
Yeah.
shot. It does help. We also had, for tribal members, why don't you tell them about the incentive they had?
Well, in this case, we look at the tradition of the giveaway, and a lot of times families are challenged with today's economy. What are we going to do for our meal tonight? And with tribal events, even the vaccination clinics that they have, we're going to offer food with that. We're going to offer incentive like door prizes. Even with the vaccine clinic, when we knew that it was in our best interest to get as many of our tribal people vaccinated as possible, we offered an incentive of $500 per person to go ahead and to get the shot. And a lot of times, that helped out. But I would be remiss if I didn't mention that we're an oral culture. We're a culture that's steeped in tradition, but how do you use Western medicine to the best of its ability? And that's when we started to embrace telemedicine, because we had that social disconnection where we couldn't meet face to face. And thank goodness that we can do that now. But there are some things that we learned that work, like telemedicine, Zoom, and though using the best of technology to continue to get the messages out that we need to go ahead and communicate to people. I think MSU, with the land acknowledgement that they've been doing, and embracing us to be a part of your circle where we can learn from each other. And I hope everyone has been able to garner, some Indigenous knowledge from what we've shared already.
Yeah, I sure hope so. Yeah, it's been from my lens as a staff member at MSU and as a parent of a student at MSU, I very much appreciated the efforts that we've been putting forth to continue and enhance that connection. And I hope that we continue to move further in that direction. In fact, I know heading up here in a few weeks, we're going to have a multi-state webinar talking about our 1994 land grant universities and the connection with our Indigenous communities. And so we very much appreciate those connections. And going back to the incentives and programs there a little bit, do you feel that those programs and incentives were effective? And kind of looking back at those programs and incentives, how have those things changed over time as we move, here into our, rounding the corner on our fourth COVID year of existence?
Well, the cash incentive is done. We still, we're doing flu and COVID shots right now. We still do them the same way with treats and things. There's a lot of confusion right now. Like we had confusion earlier, there's confusion now with the current COVID vaccine, if they need it or not, for one thing, and if it's different than previous ones. So that's really important for messaging and getting that out, especially for seniors. Especially since it's not as available as it was. It still is around town, but now for us to get it at a clinic, we have to pay for the vaccine. And so it's harder to fit that into the budget. So that's changing things, but we're still getting a fair amount, especially seniors, in to get it. The messaging really hasn't changed at this point. We're still telling people that this is updated. It is different from the previous shots. It is important to get the booster because it wanes with time, same as the flu shot. And I emphasize that the flu shot changes every year. They update the variants, and that's the same thing that's happening with the COVID vaccine. So that's why it's important to come in.
Yeah, I just before I got on the call was talking with my colleagues about boosters and whether or not I had my booster, because I'm just getting over COVID and I had not gotten my booster done yet. And I'm quite certain that I was much more sick this time around because I had not had an updated booster in the last few months, despite the fact that I teach this content regularly. I hadn't quite gotten there yet. And like you said, it really, it's important that people are getting out there and getting those boosters done. Our next question is about the community's ongoing response. So, moving right kind of into that discussion about boosters and how, what needs to be dealt with now. What is the community's current response or perspective on COVID-19 at this point in time? Is there a belief that it's over? Is there continued education or efforts to really drive those initial vaccine uptake or boosters?
Well, what we've seen so far is it's kind of a mirror of what you see from a national level, where there's some COVID fatigue that's happening. Aren't we done with this already? And a lot of times that's a discussion with their physician, with their clinic, and just getting the word out there that preventive medicine is important, especially with extenuating risk factors. One of the challenges that I have working with the Elders Advisory Board is continue to let our tribal elders know that we're not out of the woods on this. And, there's a lot of different ways that we can still be affected and being an at-risk population. I think that's important. I know the last thing that I saw, we're 5 times more likely to still get COVID-19 as far as what we get from the CDC.
Wow, 5 times more likely. Really, really significant. Let's see. I just wanted to flip ahead in my questions. I want to make sure that we get through some of our questions that are a little bit further down the list here. So I guess I'd like to kind of step, I guess, as you were talking about your work with your elders, could you talk a little bit from that sort of public relations perspective about how you, Joe, were able to communicate information about the pandemic? What communication strategies you found to be effective, what you were kind of doing from that outreach perspective?
Well, I think a lot of that comes in the personal development. So I've served on the Tribal Health Board for 4 years. I've served on the Central Michigan Community Hospital Board for 12 years. So I do have some sort of a medical background, even though it's not where I went to medical school and got my BSN in nursing like Sue has. But having that connection, when I was approached by U of M Public Health and they wanted me to participate in an AstraZeneca survey, I was all about it because we didn't have the COVID vaccine at the time. So I figured, well, I have all the risk factors. I have a pacemaker, I have diabetes, I have hypertension, I'm Native American, so I might want to look at participating with it. But then when I found out it was a blind study, it was one of those things where when we got the vaccine from the Indian Health Service, I wanted to make sure I was vaccinated. Sure. And it was one of those deals where I found out that I was in one of the control groups that wasn't vaccinated. I was able to get the study, the vaccination here, but they wanted me to continue with the AstraZeneca study just because I was a Native American at risk. And the good work that U of M Public Health did to go ahead and have a Native American population being a part of the research, I think there's a lack of data out there. And I think that's a problem not only for Michigan, but for a lot of our academic institutions to get Native involvement.
Yeah, definitely. I certainly, my understanding from what I've heard is that there certainly has been an underrepresentation of many of our minority groups in the studies around things like vaccines, and it's wonderful that U of M was able to reach out and make that connection and help provide that support to make sure that happened. So do you want to talk a little bit about how you provided education in a way that might have been slightly different, or how your role in this from the public health nursing perspective, I am dovetailed, worked with Joseph's messaging to help provide maybe a slightly different set of information, or how you communicated?
Well, from several different directions. I mean, there's the individual education and communication as people came into the clinic I made sure to coordinate with everybody in the clinic. So everybody knew what was happening, when there was vaccine available. We had messages on our phone. When they called in, it had messages that said, we are starting the immunization clinics, call this number to be contacted when we get to your age group type thing. So we did individual education, and like Joe said, there's an oral tradition with the tribe, so that individual education and information coming from people they trusted already encouraged folks to come in for the vaccine. And then, of course, there's targeted education. We actually pulled off a list from our patients at NIMKI, started at like 85 and up, started calling people as we got the vaccine in, because we got small amounts at first. And we would set them up, we have the vaccine here. Can we set you up with a time and date to come in? And we would get them in. And they always had lots of questions. Always. But we coordinated, we tried to keep up with the latest information from the state and the CDC. So we were giving reliable information as we went. And of course, that's targeted. We were targeting elders at first, the ones that with chronic diseases that were most at risk. And that works very well. Almost everybody was receptive. Then, of course, there's the group messaging, as Joe said. And they have the tribal newspaper. We did articles and ads and flyers in there for the clinics and just with general information as it came out. And we do emails that gets all the employees at the tribe, basically, very easily. And social media, of course, the tribe PR. You want to talk about how things go on social media?
Well, we use our tribal website, www.sagchip.org. We also have a tribal Facebook, and a lot of times to communicate those messages, even today with, Sue working at the resort and doing the clinic, and having that open for employees and for the patrons. Who would have thought that, an effort that's coming from the Saginaw Chippewa tribe could benefit the entire community, and working with Isabella County health department, to have those kind of efforts that happen. I think it's that grassroots effort that makes all the difference in the world.
I do want to say that things have slowed down, and so we're trying to get people to come in again now for our flu shots and COVID shots. So one of the things we do is go where people are. If they can't get transportation, I'll do a home visit and give somebody a flu shot. Today we're actually at the casino doing a clinic with the health department. And we get, I can remember the early days of the COVID clinics. If that vaccine was so precious, if we had 2 shots at the end of the day, they would go find somebody gambling on the casino floor, with gray hair, and say, do you want your COVID shot? And they would come get it. And last week was the tribal election. So Joe's on the caucus committee. So years ago, I was trying to figure out where to go where the people are coming in, and so I asked him if I could come give flu shots at the election, and he said he talked to Sean, and sure enough, I've been doing it ever since, every 2 years, that was like clockwork. And some people, when I go to chart their shots, they get it every 2 years at the election, which is kind of funny, because I'm there already, and it's easy. It's easy. All they got to do is sign their name and birth date, and they get their flu shot. So
That community connection is so important, and it sounds like it's especially been important in your experience and in your community to make sure that you have that ability to reach out individually and to make those connections with people, like you said, wherever they are, right? Whether that's the casino or elections or at home, and you're going to come to their home to help them.
absolutely.
Well, in a lot of that, when you look at it, you got to meet people where they are, and to go ahead and to look at it from a tribal perspective, a lot of times, you don't get people that venture into the reservation to go ahead and to make that contact. A lot of times, we're more than happy to go ahead and to go to institutions and to share what we know, but to go ahead and to get people to come on the reservation. It's one thing to do a Zoom webinar, but it's another thing to say, hey, why don't you come visit Sue at Nimke Clinic and see it for yourself? Why don't you come visit me and I'll show you Ondawad Elders Facility? That way you're able to participate in the tribe and see what we do firsthand, with healthcare.
That would be a wonderful, wonderful field trip for us to take this show on the road and be able to come out and see the great work that you're doing there. This has really been a fascinating conversation, and we're down to just our last few minutes. And so I want to both, as I look at my last couple questions to make sure I want to ask a few, I also want to let you know if you have anything in particular that you want to make sure we cover, please feel free to go ahead and share. I don't want to skip through and have you not be able to get to something that you would like to share. As I'm going kind of through my list and processing what we've been talking about, just kind of flipping through here. Let's see. Have you found, Sue, that your immunization campaigns with the COVID-19 pandemic have had to be more different in the past than other immunization campaigns, or how are you seeing sort of that information trend shift as we're moving forward?
Well, I can remember previous campaigns we did. Oh, remember H1N1 from 2009, I think? It has changed a lot. Oh my goodness. I helped the health department with mass clinics back then, and I can remember doing one at the high school where we must have had 1,000 people waiting in line for shots. They had medical students, nursing students, people that hadn't given too many shots before helping to do the vaccinations. People were, back then you didn't have masks. They didn't wear masks. There were sick kids everywhere crying because they had to get a shot. It has, I mean, as newborn. And
sorry, it has audio issues on my end. Go ahead.
It's changed so much this time. We've learned a lot from having to do this. It's something I could have happily retired without doing COVID stuff. But we've learned a lot for the future. We know there's going to be outbreaks again. It may be 20 years again. It may not be. But we've learned how to protect ourselves and protect our people, and still get the vaccines out. I can remember H1N1. By the time they came out with the updated vaccine for that, all the kids had it. I mean, school had started and it went through like wildfire.
Yeah.
This time they were able to slow it down. It was more deadly, but they were able to slow it down. And so we've learned a lot of lessons that we can use in the future.
Yeah, we certainly have. I work in a health department building, actually. And so I very clearly remember the H1N1 days and our lines around the block and the parking lot of people trying to get their vaccines. And we certainly approached it very differently this time. Well, with our last few minutes here, Joseph, is there anything that you would like to add that we haven't covered about, well, really anything, your experience through the pandemic, public health information or experience from your lens? Is there anything that you would like to share as we wrap up?
Well, as I share with our colleagues, I'm on the State Advisory Council for MSU Ag Bio Research. And when I talk to those people across the state, I mentioned the importance of coming into the sacred fire. And, everybody wants to be close to the fire to feel that warmth, but you got to get together in a circle and got to go into the lodge and where the healing is to go ahead and to have that dialogue. And I think a lot of times Native tribes have not been able to go ahead and to get the seat at the table. But when they find that, wow, the Saginaw Chippewa tribe has a clinic, they have a residential treatment center, they have a elders facility, and they find out that we're making a commitment to public health education right here at the tribe, well, once the CMU students see that, once the MSU students see that, they want to be a part of it because this is a career path. This is an opportunity if they wanted to go ahead and to get into the healthcare field and work with Indigenous populations, they could get a job at the Saginaw Chippewa tribe.
Yeah, absolutely. And I think there's so much to learn from the community-based model of public health that you're sharing with us today. I think there's such valuable lessons to be brought back to kind of more of our mainstream Western medical community. You've been, it sounds like, quite effective in your outreach and engagement there. Sue, do you have any other things you'd like to share as we wrap up?
Well, I just want to say how much I appreciate you guys inviting us today to share our information. Joe's the PR person. I just take care of people. I'm better one-on-one with people. But it was interesting preparing for today and realizing how much I had to share. So thank you for inviting us.
Well, thank you both so much for joining us. And thank you, Joe, for your time serving on our advisory board. We very much appreciate the time and effort that you put into that state advisory committee as well, and the lens that you bring from our Indigenous communities to that table. I again, thank you both so much for your time today. And I hope that this is the beginning of a bigger dialogue and we can learn more about what we can do to help continue to support the health of our Indigenous community members and learn in our Western society about best practices to help really bring health and well-being to the community in the really fundamental way that you've been doing there. So thank you very much for your hard work. Good luck as you move forward with your vaccine clinics. Reminders to everybody to get out there and get those boosters as I'm just returning to work from 2 weeks off with COVID. It's certainly out there. So take care. Have a healthy and well fall and holiday season. And thank you so much again for your time.
Thank you.
Thank you.
Thank you.